Hello. Good morning, viewers at home and around the world. We are glad to be back today. And as we always do, we'll be looking at very important health topic today. Tuberculosis is the topic we have for today. On 24th of March was World Tuberculosis Day. That was actually some 6 days ago. But before I go ahead, I would like to introduce the members of my crew. On my right, I have a delectable lady, always looking gorgeous.
Doctor, I'm trying to be like you.
We call her Slimmy.
Most times I don't know what to expect when you come. Always
Slimmy,
guided.
you're welcome.
Doctor, good morning.
Yeah, thank you. And on the left, I have a very respectable chief in our community.
Hi, Chief.
An elder of the people. Chief, I greet you. Pleased to welcome you.
Welcome to the show.
Yeah, thank you very much.
Sir.
Okay, and my humble self.
Yeah,
I know yours
our
sincerely.
doctor.
World famous.
Bartholomew Ofoegbunam.
Off.
I'm the medical director of Grace Valley Medical Center. So this morning we'll be looking at tuberculosis.
Yeah.
Every 24th of March, the world commemorates the World TB Day, 24th of March. Now, the reason the 24th of March was picked was that it was a major landmark when we talk about TB. It was in the year 24th of March, 1882, that Dr. Robert Koch, TB is also known as Koch disease.
Scotch.
Koch,
Koch.
K-O-C-H.
From the
Dr.
name of
Robert
the-
Koch discovered the bacterium that causes tuberculosis. And with that discovery, he created a landmark changes in diagnosis as well as treatment for tuberculosis. Tuberculosis is an ancient killer. It has been there for over 17,000 years. It didn't just start today. It has wreaked havoc thousands of years ago and still do till this very moment, to this very moment. That is why today we are talking about tuberculosis. As a way of introduction, every day about 4,500 people are said to lose their lives to this illness. And about 30,000 people fall ill to this highly preventable and curable disease all over the world. What is tuberculosis?
To start with.
Abi?
It's an infectious disease that affects predominantly the lungs.
Okay.
It also affects other parts of the body other than the lungs. But 90% of time, it affects the lungs. And when it does, we refer to it as pulmonary tuberculosis.
Pulmonary tuberculosis.
Yeah, but when it is affecting any other part of the body other than the lungs, it is referred to as extrapulmonary tuberculosis.
Okay.
Okay? It can affect the central nervous system and will have tuberculous meningitis.
Okay.
And the symptoms will depend on the organ of the body that it has affected. If it affects the heart, we refer to it as tuberculosis pleurisy. If it affects the joints and the bone, we refer to it as port disease. Port disease.
Okay.
The normal POT.
No, P-O-T-T, port disease. If it affects the urinogenital tracts, we refer to it as urogenital tuberculosis. Okay, but the ones, like I said at the beginning, that is mostly affected happens to be the lungs, the one we refer to as pulmonary tuberculosis. There is a little bit of some historical perspective so that we can all understand a thing or two about this disease. I've talked about that a discovery of the bacterium that causes this tuberculosis was made in the year 1882. Afterwards, two gentlemen, Albert Calmet by name and Camille Guerin, the second person, discovered the immunization that we now use today talking about the vaccination that we use today against tuberculosis. BCG. I know so many of us may not know how the name came about. So BCG was actually a coinage from the surnames of these two gentlemen that discovered this vaccination in 1906. Okay? I also would like to point out that Dr. Robert Koch actually won Nobel Prize for medicine in the year 1905. That was a year after these people discovered BCG that we now use today.
Okay.
Now, the name in full is Bacillus calmette-guerin.
Okay.
BCG.
Calmette-guerin.
So if you're a father, if you're a mother, and you're taking your child, your little baby, or your newborn baby to be immunized, you now have an idea that this vaccination started way back. Yes. Okay.
Now, Dr. Bass, research it 2 months.
Thank
you
you very
sleep,
much.
so.
Thank you very much. So ever since then, tuberculosis have been ravaging and causing havoc all over the world. Okay, but yes, but in the year 1985, with the discovery of HIV/AIDS, the problem became more prominent, as well as drug-resistant tuberculosis. The onslaught continued until the year 1993, when the WHO declared a global health emergency on tuberculosis. And ever since then, there have been waves upon waves of global activities by world leaders, WHO, to ensure all are geared towards seeing that we'll see the end of TB come the year 2030. And in 2006, Stop TB Partnership actually brought out a global outline aimed at ending tuberculosis on or before 2015. They had a lot of targets that were not eventually met because of lack of political will from the leadership of the global community. But all that have started to change. In 2017, precisely in the month of November, there was a gathering, a conference of ministers from 114 countries in Russia, in Moscow, geared at mapping out a global framework for the control of this deadly or highly preventable and curable disease. And of course, that heralded the event that took place in November 2018. The very first time that the United Nations had a high-powered or high-level meeting on tuberculosis in an effort to bring about eradication of tuberculosis before the year 2030. And of course, they made some commitments that I'm going to read out shortly to us. They made some commitments, talking about the commitments from from the world leaders.
From the ministers.
Yes.
In Moscow.
In
Russia.
No. This was
after
Moscow was ministerial conference in 2017,
Okay.
and then 2018 was World Leaders
Summit.
Yes,
Okay.
the United Nations World Leaders Summit. Okay. Now, among the objectives of that conference, number one was to scale up the prevention and treatment of tuberculosis, to promote equitable, right-based, and people-centered TB response, to ensure sufficient and sustainable financing, including for research, and to promote an end to stigma and discrimination that is associated with this disease, as well as to build accountability. I also want to point out that over the years, historically, because of the presentation of tuberculosis, it used to be called consumption disease.
Consumption.
Why, sir?
Why?
Consumption.
Does that
It consumes the human system.
Ben.
And that is why it's called
Because
consumption
if
disease.
the person they cough true, everything
whole
go dey
body go dey
shrink,
vibrate,
go be like-
yeah.
Yes.
Yeah.
It has to do with unintentional loss of weight.
Yes.
You know, when we talk about weight loss these days, people can lose weight for a number of reasons.
Yeah.
Of course.
Everybody would like to look like my friend in the house.
Yes.
Yeah.
Like
Okay.
me too. Make it dey lege like Kanu Nwankwo. Some people even say I look like Kanu Nwankwo because of my fine stature.
Okay,
Not
but
just MLF again.
when we talk
Confuse
about the weight loss we are talking about in tuberculosis is unintentional weight loss.
Can
It
it-
is
can-
not.
Can it be through can we call it
Dehydration.
dehydration, sir?
No,
loss
it's not.
of energy.
It affects virtually every part of the human body,
Okay.
in the sense
I
that
think it dries them up or something.
yes, anybody that has TB begins to lose weight. Okay, that's one of the major symptoms of TB, unintentional weight loss. Okay, so having said that, it would be nice to talk about the signs and symptoms of TB. But before I do that, I'd like to point out that as it stands, 1/4 of the world's population are today affected with tuberculosis. In 2017, for instance, over 10 million people were affected by tuberculosis. And out of these 10 million that were affected by tuberculosis, 1.6 million people did not survive. Among these 1.6 million people that died, 300,000 out of it were people living with HIV and AIDS.
So that actually influenced it.
Yes, is a major risk factor when we are talking about tuberculosis. Okay, there are two major types of tuberculosis:
Okay.
latent TB and active tuberculosis. Latent TB, usually someone is infected with tuberculosis, but the person does not come down with the illness, and as a result, we manifest no symptoms at all. Active TB is in a situation where one is infected with tuberculosis and the person has come down with the disease and is manifesting symptoms, and it is such a person will be highly contagious, capable of infecting the
others.
people around him or her. So it's good we make this distinction early enough. Two of them will require treatment, no matter the one that anybody has. But the major difference, like I said, is that one will not make you sick, while the other one does make us sick. Now, what are the signs and symptoms of tuberculosis? Number one, we have mentioned unintentional weight loss. You see somebody drying up over time. Number two, excessive night sweats.
Excessive night sweat.
Yes, I use the word excessive because everybody
Yeah, we
sweats
sweat,
at
but
night. Usually when we don't have power in
more
our
than-
environment.
more than
But
you
this
can
is
bear.
an unusual
Yeah.
sweating. So it comes with excessive night sweats. It comes with chronic cough that has lasted for several weeks.
Oh.
Chronic cough. Oftentimes with production of sputum or phlegm that contains blood or that is blood stained. It also presents with weakness, lethargy. Like we said at the beginning, depending on the organ of the body that is affected, the symptom may differ a little bit.
Yes, sure.
But I just mentioned the ones that are usually general. If it affects the spine, in a situation where one has port disease, the person can actually be paralyzed if it is not treated on time. So depending on the part of the body that is being affected, that will depend on the symptom that we'll get. Okay? But before we go on, it will be nice for us to open the phone lines.
Okay.
Viewers at home, numbers to call will be displayed on your screen shortly, and I'm sure Slimmy T, as always, will help us out.
Anyway, so guys, call us 08173147589, call 08105434984. We're done with the numbers.
Yeah, thank you very much. Okay, so having talked about signs and symptoms, it will be nice for us to talk about the risk factors. Okay, we are seeing a number of campaign materials that are being displayed on our screen. Okay. I think it would be nice to just run over them shortly.
It's time for action.
Yes.
Okay, sure. Oh.
The theme of this year's World TB Day, Tuberculosis Day, is time. It's time.
You're laid back.
Okay. So in this year's World TB Day, the WHO is calling on every one of us, international communities, national health caregivers, everybody, non-governmental organizations that are involved in health in one way or the other, that we need to unite forces to treat and end TB. Okay? Find, treat, all. Find, treat, all. Nobody should be left behind. Hashtag end TB. Okay? So it's time for action. Over 50% of children with tuberculosis miss out on access to life-saving interventions.
Okay, doctor, please, can I take you back to when you gave us the types of TBs, TBs rather, and when you mentioned latent, and you said this particular one does not really present with a symptom.
Yes.
Now, I want to ask, because in the case where we say most times we get cough, do you understand? And I think I've been get one friend, two of them said we've been get cough for like 3 to 4 months, and at a point we felt okay, they were actually reacting to something. Now, they weren't bleeding, nothing, but it was actually draining them. They were coughing seriously. Now, in this kind of situation, now, how do you know?
I'll need to pause.
Okay, let's take Akintayo.
Akintayo from Oyo.
Akintayo, good morning.
Tayo. See why?
Hello, good morning.
How you doing, sir?
Yes, I'm calling from Oyo State.
Yeah,
Thank you very
I
much.
want to know if the person that's close to someone that's having that thing, is it possible for the thing to be affecting the other people?
Yes.
What did you say?
Yes, I got the question.
Okay.
If you stay close to someone that has tuberculosis, is it possible for the person to be affected? The answer is capital yes.
Capital yes.
Yes, capital yes, yes. And I will explain.
That said no.
Now, the transmission of TB is airborne, though we are still going to get to that. When we speak, when we sneeze, when we sing, we push out droplets, aerosols that contain, that's for an infected person, for someone who has been infected with an active TB. Don't get me wrong. When such a person sings, speaks, spits, sneezes, such a person releases an aerosol droplets that are capable of infecting people around such a person. As a matter of fact, it's been said that when an TB-infected person sneezes, just once,
You were saying it.
such a person releases as much as 40,000 droplets. And each of these droplets is capable of infecting an individual around the person. So you can agree with me that when we have people who have TB around us, and if it goes undiagnosed, unnoticed, just like the situation she was trying to point out, someone who has been coughing for as much as 3 months, such a person may, before the end of the year, such a person may have infected tens. A whole lot of people would have been infected. And of course, you know, there's no way we can talk or sing or sneeze without releasing these droplets. So that is why it's very, very contagious. But that can only happen in active person with an active TB infection, not latent. Thank you very much for that question.
Okay, so my question is it that, are we saying that prolonged cough, I don't know how to put it, but does it become a problem, like when you have to cough for that long? Is it a pointer to you having tuberculosis?
If person they cough
For 3 months.
Answer is 100%. You don't even need
even
to
without
go,
blood.
Even without blood. You don't even need to go as far as 3 months.
No, because
anybody around you, anybody around us who has been coughing for more than 2 weeks, such a person needs to go to the hospital for proper evaluation. Okay? But you are more likely to pick up tuberculosis infection. You're more likely to pick it up from people who you live with, people who you work with, okay? In the home, in the offices, than the strangers you run into on the road. Okay, but That said, I also would like to point out that
Sorry, sir, we have Abdul.
Abdul.
This
Abdul, good morning.
is a topic that everyone is interested in.
How are you?
Woman with this thing.
Fine.
Good morning.
Good morning, Abdul. Do you have a question for the doctor?
Hello, good morning.
Good
Abdul,
morning,
reduce your
Abdul.
volume, please. Can you turn down your TV volume?
Good morning. Yes.
Okay, here's the your question.
My question is that what is the cure for tuberculosis?
What is the cure?
Yes, the cure for tuberculosis.
Okay. You have taken doctor from here.
Thank you very much. Thank you very much, Abdul. Okay. The cure for tuberculosis, though we are still going to talk more on that because we are following it sequentially. But since you have asked a question, I will give you the answer. The cure for tuberculosis, in a situation where the diagnosis has been made by a healthcare professional, usually in a hospital setting, it involves the use of several antibiotics at the same time. Usually the treatment will span from 6 to 9 months, and the person will need to be taking all of these drugs. And usually, because of compliance, to ensure that people comply very well with their medications. Now, anybody who is being treated, if he or she fails to comply with the medications as prescribed, the person stands the chance of developing drug-resistant TB, which is, of course, one of the challenges we are having with tuberculosis treatment today. Okay, so to ensure that that does not happen, we have DOT centers all over the places where people can go and be administered this drug by healthcare officials. Okay, thank you very much. Okay, so in the course of the program, we'll mention some of the drugs that we use and everything. Okay, so Slimity, you were asking a
No,
question.
so you just answered that because me, I'm actually shocked. She's been having it and then she's done series of tests. It is not presenting any form of symptoms outside the fact that she's getting drained by each day and all of that. So that is what I'm asking. Like, is that supposed to be a pointer to her having tuberculosis?
Yes, she needs to be properly evaluated. One of the strongest differentials for such a person is actually tuberculosis. But that is not to say that other medical conditions can actually not present with that. HIV/AIDS can actually present with that as well. Okay. Okay, so preventive treatment can stop TB. I'm just trying to read out the campaign materials for this year's World TB Day. Preventive treatment can stop TB infection from activating into disease. It's time for action. Only 1 in 4 people with drug-resistant TB access treatment. It's time for action. TB is the top infectious killer in the world. As a matter of fact, it is number 1. In 2017, we have said that we have Teresa from Edo.
Good morning, Teresa.
Yes.
Good morning, ma.
Good morning.
How you doing? Teresa, turn down the volume on your TV set and ask your question.
Hello?
Yeah,
Hello,
we can hear you.
Terry.
Hello?
We be there with you. Please go on.
Tuberculosis.
What do you say?
Please.
Can a child have tuberculosis?
Okay.
Can a child have tuberculosis?
Okay.
Yes, we got you.
That.
Yes, a child can have tuberculosis. Tuberculosis can occur in any age group. Anybody who is exposed can actually pick up the disease. And there is also treatment for children who pick up tuberculosis. Now, I want to also add something to it. It's not impossible for a child to have tuberculosis, okay? But if that child was not immunized with BCG at birth, such a child will have higher chance of picking up the infection. That said, BCG on its own confers only about 20% of immunity on children from picking the infection in the first instance, as much as 60% immunity from having a latent TB activated to an active TB. And usually after 9 or 10 years, that immunity wears off. So children can have tuberculosis. As a matter of fact, the BCG is not as popular in other parts of the world. It's popular in other parts of the world, but not so in USA, Canada, and United Kingdom. Because not all of them actually place the premium that we do in this part of the world. And it's for a reason. People who have been immunized with BCG, usually when they are doing testing with Mantoux test, tuberculosis skin test, if somebody has been immunized against tuberculosis as a child, the person will actually show false positive when the person is tested for tuberculosis. Okay, so that is one of the reasons why they don't find it very useful. They want to leave people with that so that when they do such a test, they can easily say, yes, this person has picked up the disease and this person has not. We have Taiwo from Ekiti. Taiwo, good morning.
Good morning, Taiwo.
Good morning, sir.
Good morning, Ejire. How are you doing?
I'm fine, sir.
Okay, go ahead with your question.
All right, sir. The question I want to ask was that the situation whereby in your teeth, so maybe there is a wound or of a teeth. What can happen to the teeth, or what is the kind of infection that will occur there?
Can you make it a little bit louder? I didn't get the question, sir.
I think it's a teeth.
As I was trying to ask, in a situation whereby in your teeth, teeth inside the mouth. Hello.
Yes,
There's
your
a wound
mouth.
in your teeth.
Exactly. So maybe there is a wound, or whenever you touch it, you perceive a partial pain over it. What can happen there? What can happen? What can cause it?
Oh, like last week.
Emeritus professor,
Last week question.
Professor,
This was supposed taking
well,
us.
Just
So he has a
Help
wound.
me with the question.
Okay, he
There's
said
a
when you have a wound in your mouth,
Okay.
and
When
I think
he
he touches
when he
it
touches
and he
the place,
experiences
there's
pain. So
pain,
I don't know.
Okay. When you have a wound in your mouth, ordinarily anybody that has wound in any part of the body, I want to believe he was referring to when we treated oral
last
health.
year, oral health.
Anybody that has any wound in any part of the body will feel pains. Okay, but if you're talking about having sensitivity, okay, I think you need to see a dentist to sort out the
Yes.
problem. Okay, but this morning I was trying to link his question to the topic we are
tuberculosis.
discussing today.
Okay.
Yeah,
So
okay. Well, you can actually
I'm
link it
advising
now.
you to I'm advising you to try and see a dentist. Okay, that will benefit you. Okay, thank you very much.
Thank you, Taiwo.
Thank you. I understand.
So we are still on this thing that they brought for this year. Their teams.
Okay, so no. So we are going over to the theme of this year. We've said that before. It's time. Okay,
It's time.
Find, treat all. No one should be left behind. Hashtag end
How do we
TB.
now find them now?
Anybody you
Anyone
have
I see
around
coughing.
you.
Okay, the person
that is
I'm
having a
dragging the
prolonged
person,
cough.
Like I
okay,
said.
encourage the person to go to the hospital
But
and be
doctor, wait,
evaluated.
are they supposed to do a scan? Because like she said, she has actually gone to the hospital, she's done series of tests and is actually presenting nothing.
Thank you very much for pointing out that. That, of course, is what we usually say in tuberculosis. Diagnosis of tuberculosis is usually not an easy one to make.
More
Okay.
calls back to back.
So we have,
Mrs. Fortune.
Mrs. Fortune, good morning, ma.
Good morning, sir.
Yes, the doctor is here to answer your questions.
All right. My question is, how can an adult prevent the disease, the tuberculosis disease that is on air? Since the doctor said it's always on air, how can we prevent it? Even when you don't know your colleague is having it or someone around you, what preventive measure can we use to prevent it?
Thank you very much for that very
guy.
important question.
Thank you.
What we usually advise people to do, if you discover that you've been coughing for some time, anytime you're in a public place and you want to cough,
I think you taught us this.
yes, ensure that your mouth is covered.
Yeah.
Okay, ensure that your mouth is covered. Before now, we usually advise people to use handkerchief or probably to use their hands. Well, not anymore, because we have discovered that some of these droplets, when you sneeze into your hand, you may not have an opportunity of washing your hands
and then you end
shortly
up
before you
shaking,
meet.
touching.
your next friend. Okay, so you end up pumping hands. So usually you should cover your mouth, angulate your shoulder, and then cough into the angle of your shoulder. Okay, with that, you're not likely to greet someone like this. Okay, but essentially, what you need to prevent this disease is to avoid as much as possible people who have prolonged cough. If you have anybody around you in the house who has been coughing for some time, encourage the person, stay at a distance from the person. Ensure that if you're within a room, inside a room with the person, ensure there's adequate ventilation, that the windows are opened, that the fans are working very well. Okay, and for some of us who are coughing, let us also learn the habit to move away from people when we want to sneeze. Move our faces away from people when we want to sneeze or cough, because you can actually not say when anybody is infected or not. Keep in mind that at the beginning we said that about 2 billion of the world population are today affected with this tuberculosis. So you can actually not say who has it and who does not have it. Okay.
Dr.
Thank
Matta,
you very much.
Two questions. One, there is this general belief, but I stand to be corrected, or you can discard it if it doesn't work. There is this general belief that tuberculosis, or people with tuberculosis, are majorly smokers. Outside the fact that it is communicable, but there is this belief that tuberculosis comes from smoking. How true is this? That's number one. And number two, sir, when you talk about the speak, sing, that's the act or actions of those who have tuberculosis in droplets from their mouth, are we saying if it touches, maybe I'm talking, the person is talking, touches my tongue, or
any part of your body,
on my skin,
you get affected.
You get affected.
Okay, so let me start from the last one.
Okay.
When we say these diseases are airborne, what that means is that you don't need to have a cut or a breach in your skin, okay, or a wound to become infected. Okay, when we say diseases are airborne, it means that the air that we breathe in, don't forget it affects the lungs in most of the cases. Okay, so it doesn't have to fall on you. Once you breathe it in, the droplets, you breathe it in. If the person has an active TB, depending on the dose that has gone into your system, yes, you can be infected.
So if somebody with a TB is in this studio now,
yes,
are you saying all of us here?
All of us are exposed.
Hey.
For instance, if any of us, because of the way we are talking, because of the way we are sitting close to each other, has an active TB, such a person is capable of infecting all others.
Okay, we have Stella
from Nasarawa. So remind me, your second question.
Stella, good morning, ma.
Hello, Stella.
Hello.
Hi,
Hello.
good morning,
Stella.
Hello, doctor.
Good morning.
Please, you said something about BCG. Is it only at birth or during the eating? Can one still take that BCG?
As an adult.
As an adult.
Thank you very much. Usually, even in Nigeria, we do know that BCG, I don't want to use the word restricted to children, okay, but the practice is that they are given to children at birth, okay, not usually to adults, for the singular reason that I've explained before now. Anybody who has been given BCG, for instance, if you screen the person, if you test the person for tuberculosis using Matta's test, okay, tuberculin skin test. Matta's test is usually the one, a lot of us may have done it. It's usually given on the inside of our elbow with a small tiny syringe. Okay, the doctor or the lab scientist cleans the place up with spirit or a swab, and then inject a small quantity of fluid injection there, and he will mark a circle and ask you not to scratch it, even if you're feeling itching sensation on that area. And then you go home and come back to the hospital after 72 hours. When you come back, they will look at it to know whether a reaction has occurred or not. I'm saying that people who have had BCG administered to them as infants, when you do that, it can give false positive result. And you think the person may have TB because the person has been exposed. For that reason, it is not popular in the US. They want everybody to come normal so that when they do such a screening exercise, usually for their population, anybody that shows positive is easier to say this person has been exposed. But in a situation where we have received such BCG, and don't forget I said also that it doesn't give 100% immunity. It confers only about 20% immunity, okay, and about 60% from picking up the disease from the beginning, and about 60% from activating a latent one to an active one. Okay, and after like 9 to 10 years, the immunity is gone, even for children who have been immunized. Okay, so this takes us to answer your question about smoking. It comes under the risk factors of tuberculosis. Okay. So number one, weakened immune system. A number of disease conditions can make our immunity to be weak. Top on the list is HIV/AIDS. Okay, diabetes is another that can actually weaken an immune system, weaken the human immunity system. Okay, severe kidney disease. People who are on some form of drugs, people who have had organ transplants and are on some form of drugs, example corticosteroids, will have weakened immunity or immune system. Okay, apart from that, some other drugs that are used in the treatment of rheumatoid arthritis as well as psoriasis can actually bring about a weakened immunity. Also, malnutrition can bring about a weakened immunity. So people who have weakened immunity can actually pick up the disease. Then another risk factor is location. There are some communities that are heavily affected by tuberculosis than others. Okay, such places include Africa, Eastern Europe, Asia, Russia, Latin America, as well as Caribbean islands. Okay, now poverty and substance use, that is where smoking, tobacco use comes in. Okay, so people who are in the habit of smoking increases their chance of picking up tuberculosis.
Okay, it increases the chance.
Yes.
It's not that it's the major cause of it.
No, it's not a cause. What it does is that it increases the risk of such a person getting tuberculosis, just like you have in HIV. Substance abuse as well, alcoholism too, can increase one's chances, can put one at risk. Not that on its own it can cause it. What causes the disease we have said at the beginning is Mycobacterium tuberculosis, a type of bacteria, okay, that was discovered in 1882 by Robert Koch. Okay, and I also said that tuberculosis is also called Koch disease. That accounts for the reason why 24th of March of every year is World Tuberculosis Day. Okay, now where you live also, and where you live and work can also increase your chances of picking up the disease. Now, if you're a health worker and you're attending to people in prisons, closed settings, usually people who are in closed settings like prisons are at risk of picking this infection, because when one person picks up the infection, because of the overcrowding that we usually have in such environments, it is easier to infect almost everybody in that environment. Now, if you're also living in the house with somebody who has TB, you are at risk. Usually what we do is that when we pick a case of tuberculosis from any family, when someone is diagnosed with tuberculosis, we usually do what we call contact tracing. Beyond doing contact tracing, we also would like to screen every member of that family, so that if they have tuberculosis, they will equally get treated. Otherwise, they will also be potential distributors of this deadly but yet curable and preventable disease.
Deadly but curable.
Yes.
It's true.
There are some complications too that can happen if we have tuberculosis and it is untreated. Okay? But before we go into the complications, I would like us to go back and talk about diagnosis. How is tuberculosis diagnosed? Okay? We have talked about...
Sorry, we have Oshoke. Oshoke from Delta, good morning.
Yeah, good morning, doctor.
Good morning, my brother. How is Delta this morning?
Yeah, we thank God. Everywhere is fine.
Yeah, thank you very much, sir.
Okay. I want to find out. Yeah, Delta is fine.
Go ahead. We can hear you, sir.
Okay. I want to find out reasons for, you see, most times somebody who has been very sexually active.
Your voice is low. Your volume is high.
Raise your voice, sir.
I said, I want to find out.
Yes, we can hear you now.
Yes, I want to find out why the reason for why somebody should be, who has been sexually active is now becoming sexually inactive. So what is the reasons? What reasons can be adduced for this?
Just a little clerking, sir. Just a little clerking. How old is the person?
About 45, 50.
Pardon?
45, 50.
Yes, 45, 50, yes.
45,
50.
50. Okay.
Okay.
The last question. Is the person treating anything at present?
Apart from, what's it called? This,
We lost that.
Okay.
I've done some clerking for you.
You did
You
do.
taught us.
My doctor, you
You
did
taught us.
excellently well.
You taught us.
Okay.
45, 50.
Yes,
is
somebody who has been
performance.
sexually active
Active.
and all of a sudden the person cannot perform as much as he used to do before. Okay. This falls into what we refer to as erectile dysfunction, and is a topic we have treated there in time past, and it can be caused by a number of factors. Okay. Number one, sexually transmitted diseases.
Ben, if it too take for body.
And as we are aging too, we are packing a lot of baggages. Our cholesterol is building up. A whole lot of things are happening. All of this will total up to actually affect our performance. But I will stop there because it's not the topic for today.
Yeah.
Okay, but I'm getting signals that we have to draw the curtain at this
I've
stage.
written it
But
down.
don't forget, whatever question you have,
You can
we're going to
always-
be back next week.
Yeah.
And from Slimity, what do you say to our viewers?
Merci.
Okay, from Chief,
I said thank you.
thank you very much, and let's meet again next week.
Bye,
Bye for
guys.
now.
Bye.